centers around the country say they have more baby boomer clients now than at any time before. Traci Donnelly is Vice President and Regional Director of Phoenix House, New York, and she joins us now to talk about this troubling trend. Good morning,
Hi.
Traci.
Good morning. How are you?
Good, thank you, and thank you for being here. When we were talking baby boomers, born between 1946 and 1964, we saw the Woodstock end and then the anti-war end and all those pressures that come in between.
Correct.
There's a lot going on for people of that age.
Sure, there sure is, yeah.
And so then when they're faced with aging, as well as, in some cases, drug abuse from before, it all piles on, as we saw in Christine's story. What are you seeing, and how are you coping with it now? Because you've had to change the ways of treatment and getting to these clients.
Absolutely. What we're seeing right now is an increase in individuals that aren't being diagnosed with substance use. So these individuals about the ages of 50, 45, 50, around there, they're going to their medical settings and their symptoms are mimicking aging. They're actually having memory issues, isolation, weight loss, pain. So they're not able to, the doctors aren't able to tease out the difference between substance use symptoms and symptoms of medical conditions.
So when we're talking substance use symptoms, what specifically are those?
They're very similar. They're isolating, you're losing weight, you're having memory issues, you have slip and falls, so you have people injuring, breaking their hips, and sometimes related to alcohol, but more increasingly related to over-the-counter drugs and prescription drugs. So we're seeing both illicit and non-illicit drugs. Are
you also finding then that these boomers who are going through these problems are maybe first doing a little self-diagnosing and more over-the-counter products on top of what they're getting from prescription, mixing that all together, and we're talking about the problem?
Absolutely. And they're at their medical clinics and their medical settings, and that's where we've tried to diversify and actually place substance abuse experts in medical settings to help catch these individuals before they hit the ground too hard.
And so how are you approaching that, and are medical setting personnel responsive to you coming in? They're saying, yes, we need this help?
Absolutely. They want us to be there for the simple fact that if we can help to stabilize the substance use, then that also helps to stabilize their medical conditions, meaning diabetes, hypertension, heart disease. Diabetes is very hard to manage if you're drinking alcohol. So we're able to help them do their jobs better if we can intervene and make a difference.
Talk more about the problems, the results of addiction.
Well, some of the problems are obviously drunk driving. Individuals want to drive their cars and get away, which is, it kind of mirrors aging. That's the whole point, is that individuals don't want to lose their autonomy, and they don't want to be identified as having a significant issue. Nobody wants to grow old, so they begin trying to help themselves in ways, the only ways they know how, and they have a history of this. So that's what they do, and then the issues become larger and larger. Their health issues become unmanageable, and they began isolating. They're isolating from their families, so they're losing social relationships, are falling apart, their medical conditions falling apart, and they're no longer working. So it all piles on, and it's very difficult to stop that ball once it's rolling.
And then what can be added are some emotional and mental health issues too.
Absolutely. With the memory loss, you have people not remembering even what they've taken medication-wise, which becomes extremely dangerous. So where they think, did I take my medicine or not, then they take it again. So they're compounding issues with memory issues. They're also, just by nature, substance use causes ulcers, and so they're sort of exactly what they're trying to stop, they're actually progressing forward.
Exacerbating the situation.
Absolutely.
So when you talk about, because when we hear something like Phoenix House and we think of an inpatient type care, when we talk addiction, this is trying to get ahead of that.
Absolutely. It's trying to, we're using screening, brief intervention, and referral to treatment services right now, and that takes a totally different modality than the typical inpatient treatment. It's more of using motivational interviewing techniques to help individuals become educated about substance use and what it's actually doing to their lives. So you're not asking them to abstain from something that what they believe is really helping them. You're more asking them to look at it. Take a look at it and think about what it's doing to your health? What is it doing to your relationships? How much do you think you drink in comparison to somebody else? So it's a matter of just starting to help them go through the process of pre-contemplation to deciding maybe I do need to do something about this, and it's more of a harm reduction model. So it's a little soft-handed.
Look in the mirror, and also family members should be aware too that be on the lookout for these your loved ones who might be going through something that we don't totally understand, but we can help for sure.
Absolutely, yes.
All right, thank you so much for joining us
very much
this morning. Traci Donnelly with Phoenix.